Thank you very much, and good evening, everybody. So my name is Mohit Mitra. I work for a company called IMEDicare. We've been helping prostate cancer patients now for 20 years. We're in our 20th year, and we work very closely with urology departments and continence teams all over the country. I work very closely with the local urology departments. I do a clinic for Lisa at Worcester Royal Hospital and Redditch Alexandra, where I provide education on medical devices to help with several urological issues. And we do a free service for the NHS basically. So I'll be giving the talk today about andrological products, basically to help with restoration of intimacy and penile rehabilitation after prostate cancer treatment. Excuse me. Thank you, Dan. As I mentioned, we work all over the UK with urology departments and provide education, but we also work with patients at home, do home visits, televideo consultations to talk about the issues, and it's a completely free service we provide. We distribute medical devices, and we are basically the only people in the country that provide the service that I'll be elaborating on further. I've met Caitlin before, talking about some of our continence products, pelvic floor devices, and it's good to see you again. Thank you. So I'm going to be talking about the penis and medical vacuum devices. So a little bit of information about the penis. You can see a little bit of information about the anatomy of the penis and how the blood vessels and the structures of the penis sort of link together. The penis consists basically of three tubes, let's say. You have the corpus cavernosa, which are the two, let's say, honeycomb-like tubes in the penis. So you can probably see the little cross-section in the middle. So when a man gets an erection, blood floods into this structure, which causes engorgement of the tissue and an erection. And underneath that we have the corpus spongiosum, which is the part of the penis through which the urethra runs. Now, please. So you can see that little cross-section there. Now, what's crucial in male erection is sort of let's say a triangle of three key things, which is the circulatory system, basically the nervous system, and then also the endocrine system, so one's hormones. And if the delicate balance between these three main factors, so components are disturbed, then that can result in basically a weakening or loss of the erections. As we know, prostate cancer and the treatment of prostate cancer often disturbs that balance. So we started out with my employer, who had a family history of prostate cancer. He left medical school early because he realised he didn't want to be a doctor, but he was passionate about potentially helping people with prostate cancer. So he identified that erectile dysfunction was a part of, let's say, something that wasn't really talked about enough, especially 20 years ago. There's been a lot of advances really in attitudes, not just, let's say, the people at home in the media, but also amongst clinicians, identifying that this is something that really needs to be talked about more, and treatments, let's say, brought more to the forefront. Excuse me. So he identified that medical vacuum devices are something that can really help restore, let's say, the circulation into the penis, and potentially help many men restore the functionality of the penis, and help patients return to intimacy if that's their aim. So you can see here that erectile dysfunction is very common. Over 50% of men over the age of 40 suffer with erectile dysfunction. So it's a very prevalent issue, and I've been with IMEDicare for 7 years now, over 7 years, and I've spoken to thousands and thousands of men. I've lost count a long time ago. Not that I keep count, but you know, I like to think that I've helped an awful lot of people overcome issues. And I've had patients call me sometimes a few weeks after seeing them, sometimes a few years, and thanking and basically, you know, telling me how basically seeing my colleagues in clinic has really helped them overcome the issues that they've been experiencing, not just after prostate cancer treatment, but also many diabetics, for example, patients with neurological diseases. We work closely with spinal cord centres as well. Thank you, Dan. So you can see as one increases in age, the prevalence of erectile dysfunction and its severity increases an awful lot. Basically, obviously men that are diagnosed with prostate cancer tend to be diagnosed in the 50s, 60s, 70s. You know, I'm not sure if you're aware, but unfortunately Sir Chris Hoy's recently been diagnosed with terminal prostate cancer, which is awful. Is you know, not even 50. So basically, one thing we want to do is raise awareness and let men know that if they're experiencing erectile dysfunction, see your GP, talk about it, potentially ask for a PSA test, because you know, it's something that ED is something that can be a symptom of prostate cancer. So we work with the younger men as well. So the effects of ED can affect one's stress levels, their sex lives, their basically feelings of masculinity as well, their physical health, and also an impact on morbidity. You know, unfortunately, you know, I've spoken to many men who have had erectile dysfunction, and they talk about how you know, they don't feel like a man anymore. Many of men have actually told me that they feel suicidal. I remember distinctly there was a chap in Kettering who had his wife with him. They were only young, but he said that, you know, basically he wants to kill himself. And you know, I always remember that conversation. I hope that chap's doing well. And so I'm going to talk about how erectile dysfunction, how the treatment for prostate cancer can affect erectile function. So Caitlin mentioned about nerve-sparing surgery. Has basically, when the prostate's removed, there's a bundle of a neurovascular bundle, we call it, which is a group of nerves and blood vessels that surround the rear of the prostate. And these nerves are crucial in erectile function. And if the tumour is quite close to the nerves or quite large, then it's not always possible for the surgeons to remove the prostate without causing a lot of damage to this neurovascular bundle. If that is the case, then it's unlikely that erections return. I had a consultant say that very few men get their erectile function back after a non-nerve sparing surgery, maybe 5%. Whereas patients that have a nerve sparing surgery where the tumour is not particularly close to the nerves or quite small, they can sort of tease the nerves away from the prostate, and it dramatically increases the chance of erections returning. Now, about 75% of prostate tumours are located towards the rear of the prostate and are therefore closer to this neurovascular bundle. So it does complicate things when it comes to nerve-sparing surgery. But the nerves are very delicate, and the process of removing the prostate does cause some inevitable nerve damage to the nerves, which we call cavernosal neuropraxia, and it can take up to 2 years for erections to return, because we have to wait for those nerves to heal. But despite the best efforts of the surgeons, the erections don't always return to where the patient would want them to be. So it's a bit of a waiting game. 2 years after surgery is when they'll know to what extent the erections are returned. Now, next slide please, thank you Dan. Patients that have had radiotherapy, because we're targeting the prostate with the radiotherapy, the aforementioned neurovascular bundle will inevitably be damaged as well. again causing this cavernosa neuropraxia, and the hope is that, again, within a few years of the treatment, that the nerve function can return. But then patients that have androgen deprivation therapy, or let's say hormone treatment, the suppression of the testosterone also can significantly impact one's erectile function as well as the libido. As I mentioned, there's that triumph of the endocrine system, the nervous system, and the circulatory system. So some patients that have radiotherapy don't suffer with much erectile dysfunction, but if they get on the hormone treatment, sometimes that's when the ED rears its ugly head. Thank you, Dan. Moving on to vacuum pumps. So a vacuum pump is basically a physiotherapy device for the penis, which ensure that one can get blood flow into the tissue and keep the penile tissue healthy, enabling the penis to basically get back to its normal size. Because if we have a reduction in circulation into the penis, that can cause an atrophy, a non-use atrophy, or let's say a shrinkage of the penile tissue from a lack of circulation and exercise, because we're supposed to get erections when we sleep. It's part of the normal REM sleep cycle that men have. So when the body is relaxed, blood will flood into the penis, and that will feed the penile tissue with blood, but also stretch the tissue out, keeping the tissue basically elastic and healthy. So if the nocturnal erections diminish for whatever reason, then the penile tissue tends to suffer and can shrink. But the good news is that that shrinkage, that atrophy, is completely reversible by using a medical vacuum pump, which is recognized as a first-line treatment for erectile dysfunction. So whatever the reason for the ED, a vacuum pump can be used to restore the size, strength, health, circulation of the penis. And if one wishes, then that can lead to a resumption of sexual activity. So these are basically just some information on some studies that have been done on vacuum pumps and how they basically can help patients that have had prostate cancer treatment. A lot of these studies, you'll notice, are very old, and that's because there's been an awful lot of research on them. It's not really cutting edge or let's say sexy science for people doing PhDs to look into, or doctors, urologists. They don't really want to do much more research on this because it's well recognized that vacuum pumps basically are first line for treating ED in conjunction with pills, for example, PDE5 inhibitors. So PDE5 inhibitors such as sildenafil or Viagra, or tadalafil, Cialis, vardenafil, Levitra, these are a group of drugs that basically work by inhibiting vasoconstriction. So what that means is the blood vessels into the penis stay open, which means more blood can come into the penis than leaving, therefore aiding in erections. So pumps and pills are first-line treatments, and it's recommended that as long as it's safe for someone to use a pill, that they should be used with a vacuum pump. If somebody's had a non-nerve sparing surgery, then it's very unlikely that the pills are going to be effective, and therefore those patients should really be using a vacuum pump. So what I do with the hospitals is I do a clinic every month at Redditch, Alexandra and Worcester Row, where I see up to 6 patients in each clinic, half an hour each, educating them on how a vacuum pump is used for physiotherapy or penile rehabilitation, how the device can be used in the long term to keep the penis healthy, and also how it can facilitate intercourse. Basically, with the pills, PDE5 inhibitors, sildenafil usually is taken about an hour before any intimacy. It stays in the system for between 4 and 6 hours. Some people make the mistake of thinking that they take a pill and it's going to get them in the mood for intimacy, but one needs stimulation in order for the pills to be effective. Tadalafil, on the other hand, Cialis, stays in the system for 36 hours. So quite often patients will take it in a small dose daily, so there's always some in the system, and it can therefore be better for more spontaneous intimacy rather than sort of setting a time with your partner. Basically, as I mentioned, we discuss the devices in clinic with the patients. Sometimes we see the patients before they have their prostate cancer treatment, quite often afterwards, and then we go through, I ask patients candid questions actually about, what their erectile function is currently like. Do they get erections? How regularly? How hard are they? Have they noticed the shrinkage to the penis? And through that I can sort of build a physiotherapy plan and give that to the patient. Sometimes it means using a pump every day for 2 weeks. Sometimes it means using it every day for a month or 5 weeks. 10 minutes a day to restore the health and fitness of the penis, and then how to use it in the longer term a few times a week to maintain the health and fitness of the penis, and then how it can be used for intimacy. I talk the patient through the steps, and if they want, they can even use the device in clinic in my presence if they're open to doing that, so they can go home knowing for certain that the vacuum pump will give them an erection. And for some patients who haven't had an erection in 3 or 4 years, let's say, or longer, they find it hard to believe that there's a bloke sitting in front of them saying that you can get an erection right now. So basically, the patients can go home knowing that it works for them, and then the GP will prescribe them a device, because patients that have had prostate cancer or prostatectomy radiotherapy in Worcestershire and many parts of the UK can get them on prescription. Some counties, the CCGs, don't allow for vacuum pumps to be prescribed, unfortunately. Just over the board in Herefordshire, for example, the urology department need to prescribe them, because the GPs in the region, unfortunately, don't allow for pumps to be prescribed. So I work with some parts of the country where that's the case: Oxfordshire, parts of Cheshire, North Wales, Gwent as well. Unfortunately, some GPs don't allow them to be prescribed, so either the hospitals have to prescribe them or the patient has to purchase them privately. So it's important for us to provide that education to the patients. So firstly, they're confident in sort of asking their GPs to prescribe it, and then if there's something they have to purchase, then at least they are basically confident that it's something that's absolutely going to enable them to get an erection. So moving on to a bit of information on the product itself. So basically, as I mentioned, the Solmarex series are available on prescription through GPs. About 95% of medically prescribed pumps in the country are this type, the Solmarex series. And that's because we're the only people that really do this kind of service, providing education on the devices. So pretty much every urologist that focuses on erectile dysfunction, or the urology CNSs in the country will be familiar with vacuum pumps, and they'll have either myself or one of my colleagues. We've got 10 reps around the UK and Ireland providing this education service, so pretty much all of them will know one of us, and be recommending that patients learn about devices if they express interest in that. So a little bit of information on the vacuum pump. I'm just going to put down the mic and just basically show you the device and how it works briefly for a few minutes. So the device consists of a negative pressure pump. This is the only component that should not be washed. There's a tube for the penis to go into. Some water-based lubricant is used to achieve a seal and to protect the penis from friction. It's recommended that the pubic hair is trimmed, and once the penis is inside, one must hold the scrotum down, keep it taut, because we do not want a testicle getting sucked in. So I say to my patients, when you're using the pump, please don't answer your phone, because you'll be up an octave, or down an octave. So basically, one should pump slow and steady, because particularly if one's on blood thinners, because we don't want to bruise the penis, or if they have foreskin, we don't want the foreskin to get swollen through overzealous pumping. So 3 pumps followed by a 5 to 10 second interval to allow that negative pressure to slowly draw blood into the corpus cavernosa, the honeycomb structure I alluded to earlier. 5 seconds, 10 seconds, let engorgement occur. 3 more pumps, wait a further 5 seconds, keep repeating until an erection is achieved. Now, I mentioned earlier about this non-use atrophy that can happen to the penis quite often with erectile dysfunction, so the penis can shrink. It will take usually a few weeks for that shrinkage to be reversed. Now, patients that haven't had an erection in a long time, it's likely they'll only be able to pump up to a semi-erection before the penile tissue, because it's lost its elasticity, will not be able to stretch any further. And they'll know when to stop because the penis will feel uncomfortable. There's a bit of a stretching pain, let's say, in the head of the penis. When it's uncomfortable, stop pumping. You can hold it for up to 5 seconds to let the tissue stretch before you must release the pressure with this button here. Once the penis has gone flaccid, that's 1 repetition of the exercise complete. Pump up again slowly. When it's uncomfortable, count to 5, release. Each one of these exercises takes between 30 to 60 seconds. Everyone's penis is different. Some people can get an erection within a few pumps, some people it takes a lot longer. This exercise is repeated for 10 minutes. Doesn't matter how many erections, everyone's different. Some people only do 10 erections in that time, some people 20. Basically, that's it, you're done for the day. Wash that, do not wash that. Repeat this daily for about a month, depending on the level of the shrinkage. So in that consultation, because of the questions I ask the patients, the candid questions, I can sort of develop that physiotherapy plan. For some people that haven't had much of a shrinkage, it might only be 2 weeks, some people 4 or 5 weeks. Even patients that have had a retracted penis and it's retracted pretty much all the way into the body, with regular usage, they should be able to restore the length of the penis. So every day the penis will get bigger and bigger, and eventually the penis is back to its full erect length. Except those that have had their prostate removed, they usually lose maybe about ½ an inch of length of the erect penis. But you'll know when to sort of stop pumping when you've reached that phase, because that stretching pain in the penis will disappear. Once the patients have achieved this, we've completed the initial physiotherapy stage. Now the patient can move on to just using the pump, say 3 times a week for 10 minutes to maintain the health and fitness of the penis. So the first stage is about restoration, the second stage is about maintenance. If the patient were to stop using the pump, it's very likely that slowly over time that atrophy will kick in. So I say to patients, if you don't use it, you can lose it, but if you train it, you'll maintain it. Now, to use the device for intimacy. Now, basically, with erectile dysfunction, especially if the patient's had prostate cancer treatment, the muscles at the base of the penis that help hold in the blood, which are linked to the pelvic floor, they may not be doing their job anymore, and therefore once the pump's removed, the penis goes flaccid because there's nothing really working to help hold in the blood. And of course, because of the nerve damage, because of which can also impact circulation to the penis as well. It means that you're not going to be able to maintain an erection for intimacy. But there are rings provided with the device, which are available on GP prescription as well, that sit at the base of the penis and act like an extra muscle, a little bit like a tourniquet, to retain the blood that we've pumped within and maintain an erection hardener for penetrative intercourse. So basically this is an example of the most popular ring. The idea is once you've achieved that full erection again, you'd place a ring on the base of the device, pump until full erection, and then you can displace the ring onto the base of the erect penis, and that will sit there and hold the erection. It requires a bit of practice and experimenting and finding the right type of ring, and it can be safely worn for ½ an hour at a time. Patients should never fall asleep with a ring on. Penis will look a bit blue or purple whilst wearing the ring, but that's to be expected because of the oxygenated blood. But should be able to hold an erection hard.
maybe even 95% or 100% hard. 2 rings can be used as well if one's not enough, and the rings can be used in conjunction with pills. They shouldn't be used at all in conjunction with any intracavernosal injections into the penis, which are second-line treatment, because it's very dangerous to trap such chemicals in the penis. So I say to patients, please don't mix your poisons. You shouldn't use the pills and the injections together either. Rings should not be pulled off either. You basically get your fingers inside, allow the erection to fade, and then pull off the ring. It only takes about 15 seconds to remove the ring. And once the patient knows which ring, they prefer, they can ask the GP to provide them on a repeat prescription. The only thing the patient needs to pay for themselves is some water-based lubricant, for getting a vacuum seal and protecting the penis. We recommend ultrasound gel, which is what they use for baby scanners, because it's thick and viscous and very cost-effective, bought online. And then if they need an intimate lubricant, something water-based as well. Now, with regards to, sorry, could you go back, please? With regards to contraindications, basically, there was a study that showed 92% success in getting an erection with a vacuum pump. Those 8% of patients that didn't, well, because they physically cannot use one. The doctors cannot recommend one because of their medical conditions. So, but if used, those patients will get an erection. Patients with sickle cell disease, for example, any sort of blood clotting disorders where, for example, the INR is not stable, if they're on warfarin, haemophilia, Hodgkin's lymphoma. If the patients do take blood thinning medication, as long as the clinicians, the doctors or nurses, are happy for them to use a vacuum device, we can go through them, but they need to pump extra slow, and they are limited in which rings they can use. So some of the harder rings they can't use, but that softer one there is the one that we'd recommend. Please. Now, so the pros and cons of using a vacuum pump. So they're easy to use once you get your head around it. So we do recommend patients use them in clinic. It pretty much guarantees an erection on demand, and provides that physiotherapy as well as the ability to return to intimacy if desired. Low cost to the NHS, about 5-year cost is around £250, a lot cheaper than pills and injections or whatnot, and it's non-invasive, so we're not putting anything into the body. So those that might be reluctant to use pharmaceutical options, it gives them a reliable means of keeping the penis healthy. And as I mentioned, available on prescription. Patients that want to purchase them privately, you get a lifetime warranty as well. It's only a 5-year warranty if the device is procured through the NHS, but a lifetime warranty if they're purchased. So the cons, they can be a bit clumsy for some people, difficult to use if one has poor manual dexterity. There is a battery operated version for those that, for example, have really bad arthritis, and using a pump might cause them discomfort or might be difficult for them. Obviously, for some patients, getting their head around the vacuum pump, coming to clinic appointments, committing to using something several times a week in the longer term may not be palatable for them. And then sometimes you have partners who don't like the sight of the vacuum pump. They're for whatever reason, it's not something that they take to. And then also getting a vacuum pump, pumping up before intimacy, it means that the intimacy, the sex isn't spontaneous. It's a bit regimented for some people, so there's that also. And basically, some people don't like the appearance of the penis because it, as I mentioned, might look a bit blue or purple. Sometimes the penis might feel a bit cold because of poor circulation. The way around that is to get some water-based lubricant, warm it in a basin of warm water and put a warm lubricant on the penis. But as I mentioned, that can be a bit regimented, and some people don't like that. So the device, as I mentioned, it's the most widely used pump in the country, and pretty much every major urology department in the country has a clinic service, or at the very least refer patients to us for home visits or televideo consultations. So they're widely used. It's a free support service as well. So if anybody here already has a device and they're struggling using it, you can reach out to me. We can do a consultation to discuss it. There's no obligation to purchase as well for those that are interested in purchasing it. We can do a consultation. If anybody ever needs support in clinics, patients can ask the nurses to get booked in to see us. They can bring the device with them. They can use it in my presence if they wish. And so basically we have this education service because a lot of people, they, basically, I've heard of plenty of patients that, their GPs or their doctors have said, look, you've got prostate cancer, you've had prostate cancer treatment, you should give up on having a sex life. You should, that's just how it is, unfortunately. But that's incorrect. There is an avenue for returning to being intimate, for keeping the penis healthy. I'm very proud of what I do. When I first started my job, my employer said, it's probably not something to talk around, talk about with your mates in the pub, that kind of thing. Wait a while until you've sort of found your feet in your role, and then I'm sure you're going to be able to speak candidly and proudly about what you do, and that's absolutely correct. I'm very proud of the work I do. I go home every day feeling like I've helped people, and that's something that, on a personal level, helps me sleep well at night. Before I worked in this role, I went travelling around Asia actually for 4 months because I felt like I needed to experience something different, and I came home after travelling and I found this role, and sort of any sort of personal, let's say, feelings of not fulfilling my potential, and sort of any depression I had within a short while went away, because I had this feeling that I was able to help a lot of people, and I'm, like I said, very proud. So I've already talked about this. Next, please. Thank you, Dan. So for those interested in learning a bit more, we've got some YouTube videos, which are private links. You can't find them online by searching, but if anybody wants to take a picture of this, it will take you to a video I've recorded, which I give to all patients. So everything I've talked about in terms of the protocol for using a pump is on that video. It's over 10 minutes long. So please feel free to take a picture. Basically, I'll now talk about some continence products, because we also provide a number of solutions for urinary incontinence management. So you can't see on the bottom, but basically we've got some continence products on the left for light incontinence, and the further you move to the right, more severe urinary incontinence. So I'll be going through some of our products now, many of which are available on prescription. So firstly, we've got a range of washable continence garments called Whatever Washables. We have a male range and a female range. We have the largest selection of washable incontinence garments in the UK, and they are available on NHS supply chain for your local continence service to prescribe. I know Elaine Sutcliffe, who's the lead of the bladder and bowel team. I know her well, and I've done several meetings with the team. And just on Friday, actually, some of her team was saying that the washables that we have, they've now listed as a first-line treatment for stress incontinence. Basically, we've got a range of boxers and briefs for men. They can absorb, some of them up to 650 millilitres of urine. Some of them are 150 capacity, some of them 300, some of them 650, which is more than a pint of urine. And they can be washed and reused. They can be washed 200 to 250 times. Just stick them in the washing machine. No fabric softeners or bleaches, but they can be washed on 40 or 60 degrees. And basically they have 3 layers. So basically there's an outer waterproof layer, so unless they're oversaturated, they shouldn't leak. There's a middle layer which is impregnate, which is the absorbent layer, they're impregnated with silver ions, which means they neutralize the odor-causing bacteria, which some disposable pads are not great at doing. And then there's an outer layer, which is the inner layer, which wicks away the moisture, so that wet feeling will only be there for about 5 or 10 minutes. And because they can be washed so many times, they can save an awful lot of money with regards to disposable pads if you purchase them themselves or get them through the continence team. And they're a lot better for the environment, because disposables, when they're thrown away, they can take 300 to 500 years to biodegrade in landfills. And if they're incinerated, then all that carbon, of course, is being released into the atmosphere. And not to mention, having a washable undergarment is a lot more dignified than using pads, and convenient, because if one's going abroad, you know, maybe on a cruise or anywhere, maybe taking a whole load of pads with you, half a suitcase full. So there's boxes, there's briefs, they go up to 5XL in men in size. So, you know, basically many men can be accommodated. So the 650ml option for those with sort of more severe stress incontinence are available through the continence team. So if you are interested in them, if you already have links with the continence team, reach out to them, let them know that you'd like to try the washables. And I'm sure they'll be able to provide them. Or you may need to ask your GP to refer you into the continence service if you've not met with them previously. Next, I'd like to speak about pacey cuff, which is what some people would call a penile clamp, which sounds pretty medieval. Doesn't sound very safe, but this is what we call a urethral control device. Now, this is developed by a vascular surgeon from Canada and his name is Jack Pacey. So he recognizes a lack of safe penile clamps out there, because many of them are basically like, and Kate will know, glorified freezer clips. You pop them on the penis, they're going to shut off the circulation as well as stopping the urine leaking out, but that of course isn't safe for the penis, especially if somebody falls asleep wearing one. So what pacey cuff has, it's designed in such a way where you have this pad here at the bottom which sits on the underside of the penis, which means it applies pressure just to the corpus spongiosum through which the urethra runs. So it's occluding the urethra and preventing urine from leaking out. But on the top of the device, there's a little cutout here, a little square, which means there's no direct pressure being applied to the dorsal blood vessels, the blood vessels on the top of the penis, which you would have seen in the earlier slide, which means the circulation is preserved throughout the entire penis, and we're shutting off urine leaking out, which allows the bladder to fill between voids. And the bladder is, you know, basically a group of muscles, and therefore can be exercised. Now, those that are leaking a lot, the bladder can shrink because it's not going through those normal stretching cycles that one would normally get if you don't suffer with incontinence. So because that bladder atrophies, by allowing it to fill between voids, it can provide some element of bladder retraining and increasing the bladder capacity over time, alleviating some of the sort of symptoms that people may get. Pacey cuff is very popular with surgeons that implant artificial urinary sphincters, because it allows patients to get that feeling of having urine back in the bladder and exercising the bladder pre and post surgery. The only thing is pacey cuff isn't prescribed. We're hoping that next year it will be prescribed, because there's a current study ongoing with a surgeon, Mr. Yang, in London, I believe, where basically they're showing that it's very effective in helping patients, and we can then use that data to approach the NHS Business Authority and ask for it to be made available on GP prescription. So we're hoping that can change soon. But it's £69. It'll last 6 to 8 months. It's washable and reusable, so patients can keep it in the gym bag, for example. It's small as well, so it wouldn't get in the way of the golf swing. And very popular with cyclists, people hiking or running, and swimmers. So if somebody's been, sort of a keen swimmer or cyclist their whole life, and then after surgery, they limit their exercise, of course, that can have other health issues. So the pacey cuff can enable patients to return to sort of physical exertion and activity. Next is a prescribable product called Afex. It's an external urinal system. It's the most widely prescribed adhesive-free body-worn urinal in the country. We provide free trials. It consists of a garment that holds everything in place. You can see on this little picture here, almost like there's a pair of shorts version or a jockstrap system. Everything is held in place without the need of adhesives. There's a little cup to hold the penis, and then there's a variety of different bags that can hold the urine. Everything's washable and reusable, lasts 4 to 6 weeks. We do free trials, so I can come out to the patients and residents, fit them with a trial device. After a couple of weeks, if they like it, then we can get the continence team or the urology nurses to do a letter to the GP, and the GP can prescribe it on FP10 prescription. It's low cost to the NHS. Around the clock coverage for an entire year is about £300, so less than £1 a day, which is a lot cheaper than convene sheaths and disposable pads in the longer term. Next, we have another continence system prescribable called Men's Liberty, and this is an alternative to convenes and sort of condom catheters, because rather than sticking to the base of the penis, it sticks to the head of the penis, and it uses a hydrocolloid adhesive, which is a bit like a stoma dressing. It's very strong, very secure, can stay on for 48 hours. There's a small bag that comes with it, which can be supplemented with a larger bag. So because it's a discreet 240ml bag, it will sit under the garments. Not very revealing, shouldn't get in the way of the golf swing as well either. Basically, GPs can prescribe a starter kit for patients to try and then prescribe it in larger boxes thereafter. Again, I can come out and provide education on any of these products, and that's completely free. There's no obligation to go forward with anything. And basically what I can provide your team, your group with is a selection of these prostate cancer books as well, which is developed by Dr. Jyoti Shah, or Miss Shah. She's a urology surgeon. She works in Peterborough. She used to be in Burton. And she recently received an MBE for her charity work. So she's created this prostate cancer survival guide, which talks about, a complete A to Z of prostate cancer, pre and post treatment, all the different treatment options. So I can provide the support group with a number of these, as many as you'd like really. So if anybody's interested in accessing an online version, if you take a picture of that, it does require you typing it all out, but I can email you the link as well, so you can have an online version as well as physical copies. How we can support your group. So there's a number of brochures on our products at the back of the room. I can provide as many as you want. I'd like to come again, usually I speak every 18 to 24 months at support groups. I believe it's the first time I've been to this grouping, but basically, we do regular talks. So if there's any new members of the group, I can come back in the future, give another talk, and we can provide with the books as I mentioned. If anybody would like to, we do a fundraiser. Basically, we've set a challenge to climb most peaks in Europe, most mountains in Europe, every country's biggest peak before 2030. We just recently went to Greece and climbed Mount Olympus, or one of the peaks. We couldn't get to the top of Mount Olympus because our guide basically cancelled at the 11th hour, so we couldn't get the climbing gear to go all the way up to the peak. But we're aiming to do every major peak. We've already done a few. Poland, everyone in the UK, Greece, we're going to be going around. So if anybody would like to donate to that, we'll be raising for TACO and for Prostate Cancer UK. So when we do our next climb in the spring, I'll send an email out to the group to see if anybody would like to sponsor that. So also, if anyone has any questions about how they can access the hospital services, the continence services, feel free to get in touch as well. So that's the end of my presentation. If anybody has any questions, please ask. If anybody would like to have a personal, private chat, please take a picture of my details there, and do not hesitate to reach out. Thank you.
Is it off now? Did you hear me?
Yeah.
Thanks, Mark. Very interesting.
You're welcome.
I think I've got my Christmas list sorted. Are there any questions out there?
Obviously, everything here is very a lot of private issues. So I do find when I come to support groups, there's I'm lucky if there's a question, to be honest. But then I do get a number of emails or text messages after, and that's perfectly fine.
Fascinating topic.
Yes, absolutely. But thank you very much. I hope you have a great evening, and also I'd like to, basically, give my admiration to the choir, because what you've done, raising £10,000, it's no small feat, and I'm sure that money is going to be used well, and it's very admirable.
Thanks very much.
Hello, I'm not talking today, I'm leaving it all to Paul, but I've just got a few things to say.